Welcome back to Inside. I'm here with Dr. Carolyn Greer from Bowen Recovery Center. How do people know if they are a candidate for Bowen Recovery Center?
Well, we like to think of ourselves as the first stop for anyone who's struggling with a substance use disorder, specifically opiates. It's very often that we'll see someone and think that they might be able to be treated in one of our offices versus in an opiate treatment program. But because we're accessible immediately, we can see someone without an appointment and we can get the whole picture. If we aren't going to be the ones who are going to be providing treatment, we obviously have a great relationship with all the different Bowen centers throughout Northeast Indiana.
Well, let's talk about what makes you different. There are a few things. One, you do treat opiate addiction with medication.
Yes.
And is that different from other places?
Well, an opiate treatment program in general, where there are 18 of them in the state of Indiana, on the surface are all the same. It's the only place you can use methadone to treat an opiate use disorder. It usually is a high intensity level of case management, counseling, and medical care. I think what separates the Bowen Recovery Center from maybe other OTPs is the fact that we have this hand-in-hand relationship with one of the best community mental health programs in the entire state of Indiana. No matter where our client's home is, they can access mental health care, medical management, and other wraparound services such as skills coaches through our other Bowen centers. And
those things are really important for the entire treatment, right? The treatment, kind of that holistic approach.
Yes. We know that when people are in active addiction, many things sort of go by the wayside: jobs, education, parenting, relationships. And we know that good mental health care, specific cognitive therapy, assists people so not when they stop using drugs, they're able to be productive members of our society and in their family.
We've talked about this before, but I think it's important to revisit the fact that you feel like that medication use is necessary to help somebody through an opiate addiction.
Yeah, we know that without medications, about 90% of people will return to illicit opiate use within 6 months. Now, if I was taking care of you for blood pressure and I said I only have a 10% chance this medicine's going to work, you would probably walk out of my office. So methadone's not the only medicine, but we know that everyone needs to be assessed for medical treatment.
Now, you mentioned this, but I think that we should make sure people know you can walk in to Bowen Recovery Center.
I just left there today. We had 3 people walk in from another county that came in, and we were able to see all of them right away. We take appointments, that's fine, but no matter what's going on, even our current clients, a lot of it is sort of a walk-in basis.
If I'm watching this and I know somebody who I believe has a problem, is there anything I can do to get them to seek help?
I think a lot of times when family members have someone who is struggling with a substance use disorder, things that we think are helpful are not necessarily helpful, and that's a classic enabling. A good line to say to people is, I'm going to do everything I can to help you get better. I'm not going to do anything any longer to help you stay sick. And we meet with families too. If they're not necessarily, if their loved one isn't ready to come into treatment, we can talk to them. Our outpatient offices also have great, strong family programs. We also know that involving the family in recovery, especially in people under the age of 25, is one of the biggest markers for success.
So very important. There is a real epidemic, and people do need to get help, and it touches every facet of our society.
It does.
Well, if you need help, or if you know someone who needs help, Bowen Recovery Center can help. You can walk in, or you can make an appointment. They're just off Coliseum. Give them a call, 866-239-6053, or look for them on Facebook. We'll be right back.